the next speaker, Dr. Rubens BELFORT. The title is very interesting, Second Opinion in Ocular Oncology for the GP, the Oncophone.
Good morning. Thank you, Professor Singh, Professor Honavar, for the opportunity to be here in India. Is always a great pleasure. I brought my own photographer. Come on, we have to document things, guys. Is it good? There we go. Okay, so most of you in the audience work with ocular cancer, but let's think about the general ophthalmologists. And you've seen a number of presentations today with different kinds of cancer, different symptoms, very specific ways to treat these patients, not only to save vision, but also to save life, right? So here you have a squamous cell carcinoma of the surface of the eye, very common in India due to the UV you're exposed to. This is a patient with conjunctival melanoma. Might be necessary a wide resection. For you, it's very obvious. Rubens is thinking this is ocular adnexal lymphoma. You're right, Dr. Singh. How about this one? But maybe for the general ophthalmologist, this is a more difficult diagnosis. And of course, we have metastases going to the eye, primary uveal melanoma, retinoblastoma. And Dr. Singh might have more precise data, but if you ask ChatGPT, the general ophthalmologist in Brazil will diagnose a choroidal melanoma every 20 years. So how can you keep this guy up to date on everything he needs to know to establish the diagnosis and treat these patients? So in the end, we receive very advanced ocular cancer cases, like this poor girl, or these carcinomas. I don't think you get many of these in Taiwan, but we do in Brazil. So how do we change that? Our idea was to create a YouTube channel explaining to general ophthalmologists how to treat these tumors. An Instagram just to remind them of ocular cancer. Of course, we keep teaching general ophthalmologists, but the idea here is not to teach them every detail of the treatment, but offer them a way to establish the diagnosis and know if this patient needs to be referred. There comes the Oncophone. It's a free consulting service through WhatsApp, only for ophthalmologists. We don't reply to patients. This is not for consultation of patients, just fellow ophthalmologists. Informal, very safe, fast, and this is how it works. Every morning, we get a couple of messages. Again, it's very informal. A picture, what should I do? And we try to help these colleagues. So here, a very brief video. Retina people, the macula is normal, relax. But if you see, this is done with a phone and a 20 diopter lens. And Sharpie, right? No chance of progressing to a melanoma, no need to refer this patient to a center, sometimes very far from where he lives, right? So we took a look at the data, 4-year review. We got 1,055 consultations from ophthalmologists. You know, most anterior segment, we worry about that. Probably people are not dilating pupils enough in Brazil to check the back of the eye. Very few pediatric cases, but half of them we thought of retinoblastoma, and we advised for the ophthalmologist to refer this kid to a tertiary service, okay? The less advanced cases, we try to help the ophthalmologist to treat. So we advise on no-touch excision biopsy, and of course, if possible, to refer the patient to a specialist. Of course, this is far from ideal, right? Everyone deserves someone, Dr. Honavar or Dr. Singh, to take care of their ocular cancer. But in a less ideal world, we try to provide help, and it's very easy. Any ophthalmologist in Brazil gets our number, and you see we get 2 or 3 consultations every day. I know in Europe and United States you would be arrested for this, but maybe in Asia, the system where you work would allow for a method like this to aid the general ophthalmologist and help our patients. The Oncophone doesn't pay much, so I have my side job here. If you guys need a tuk-tuk, let me know. I'm a very good tuk-tuk driver. India has been very kind to us. मैं Brazilian हूँ, फिर भी दिल है Hindustani. Thank you, Dr. Singh. Thank you.